series of the neck development which you had begin with. Now we continue that and finish this thing off on the development of the neck. So we learned this particular neck region develops from series of undulations. We call them as pharyngeal arches, and between these elevations we have a narrow cleft or narrow gap. We call them as pharyngeal arches, pharyngeal pouches and pharyngeal clefts. Now as the has got two sides of it, endoderm and extoderm, we have these particular things named accordingly. Outside one or ectoderm side, we call them as cleft, and inside one, which you can see there's inner side mucus lined part which is lined in yellow, we call them as pouches, and in between these gray shadows we call them as arches. And if we start counting on them craniocaudally, there are 6 to appear and 1 drops off. We have 5 pharyngeal arches, and in between these 5 pharyngeal arches we have these clefts and the grooves which are 4, right and left counting together, we call them as pairs. Now each of these elements is going to give rise the muscular structure, the skeletal structure, ligaments, etc., which is point of interest. And the clinical problem, if you have trouble in development, what can go wrong? So this particular mid portion is having this mesenchyme sourced from 1, 2, 3 elements. Out of that, this is of concern, neural crest cells, which is a new inclusion into the mesenchyme element coming from elsewhere, migratory cells settling into the mesenchyme, transforming into tissues, which is going to give rise this particular skeletal element like frontal bones, sphenoid, temporal, mandible, etc., etc. And rest thing is coming from either paraxial mesoderm or lateral plate mesoderm. Now individually catching up these particular arches, we get this, the arches is supplied with the blood which is coming from the arteries, we call them as arch artery 1, 2, 3, 4. Likewise, we name this, and each of these particular arch content is supplied by the nerve, we call them as arch nerves. First arch we have dedicated nerve, second, third and fourth and sixth together they have an arch as well. So first pharyngeal arch, derivatives like cartilage, muscles and the nerves, we just learned about it. Some of the bones cartilages develop from it, muscles and nerves. So we have to memorize what are the parts of the bones and cartilages are programmed from here, developing in adult bodies, and the nerve supply from this particular muscle which is coming to this region is coming from the trigeminal nerve, third division, we call them as mandibular division of trigeminal nerve, which is supplying to the muscle of mastication, and a number of muscles which is deriving from this particular region, which are charted over here. We have to memorize like just like this: muscle of mastication, mylohyoid, digastric anterior belly, tensor tympani, which is a middle ear muscle, and tensor tympani middle ear muscle, and tensor palatini, which is a palate muscle. These are the things which is coming from first arch, and they are innervated by one nerve only, mandibular division of trigeminal nerve. If you do not remember mandibular divisions, it's fine, just trigeminal nerve is good enough. So this far we have talked about. Along with that, the bones which is deriving of it, namely important over here is the mandible. We cannot forget about mandible and the small tiny ear ossicle, Malleus and Incus. This Malleus Incus, small ear ossicle present in the middle bone portions of the ear, is responsible for the audition. That means whatever the voice you are receiving, that is conducted through these particular bones. If you have missing piece of these bones, we do not receive this particular transmitted sound to the inner ear, and so we cannot hear it properly. We call this condition as deafness. This is a deafness which is a error or interruptions of transmission of sound. We call them as conductive type of deafness. But coming from this, we are going back to the discuss about other arches. This is for the today. So second arch, likewise first arch, they have the same thing. Some of the cartilage grows from here, from this particular mesenchyme element. Some of the muscle coming from mesenchyme element. Some of these muscles or of the muscles are supplied by the nerve. So the dedicated nerve for the muscles which are coming from second arch, we call them as facial nerve. So, whatever the muscles, they are coming from or deriving of the mesenchymal tissues from the second arch, they are supplied by the facial nerve. That is a rule, easy for. Now, what the difficult thing for us is that memorizing these names of the muscle. We start with the easy one, all the muscle of facial expression, that is easy one to catch. So, second pharyngeal arch, that the mesenchyme derives from here, all the muscle of facial expression, and they are supplied by the facial nerve. Second thing to catch over here, we caught this anterior belly of digastric. Now, we have the posterior belly of digastric, which is coming together forming a triangular region in the mandible. We call them as mandibular triangle or submandibular triangle. So, this particular muscle, posterior belly of digastric, this is point of interest, MCQ point. Anterior belly of digastric supplied by which cranial nerve? Posterior belly of digastric supplied by which cranial nerve? There are two different nerves for these two different muscle bellies. So, this thing we have to keep in mind. Other than this, a tiny middle ear muscle, we call them as stapedius. This is also a very intriguing muscle and very important muscle, stapedius, which is related to a bone present in this middle ear, which is known as the stapes, which is related to it, is also derived from it. Apart from that, we have muscle which is known as auricular muscle, stylohyoid muscles, they are derived from here. So, you have to memorize these names of the muscle which are sourced from here and nerve supply to it, and coming to the last part, the cartilage and the bone. So, we have a bone in the neck region, we call them as hyoid bone, which is lying above this larynx or voice box. So, this particular hyoid bone can be split into two parts, upper part, lower part. Upper part of the hyoid bone derived from second pharyngeal arch, which is coming from the second pharyngeal arch derivative. Along with this, we call them as the cornu or horn of this hyoid bone. So, this particular tiny bone or cartilage which is present above this particular larynx, we call them as hyoid bone, upper half of it derived from it. And other than this, we have a middle ear bone, we call them as stapes, that is derived from this particular region. Now, a ligament, a small ligament derived from here, we call them as stylohyoid, which is coming from styloid process. Apart from that, we have this particular bone, side of this particular ear, we call them as this particular bone, temporal bone. Temporal bone has a process, we call them a styloid process. It is a very skinny styloid process that is present. That styloid process also derived from this cartilage. So, these are not for narration, they do not ask about describe things. They drop an MCQ on this and ask about whether you know the source of it, whether you understand the nerve supply to it, whether you understand the logic of this particular source of these muscles. So, derived from which arch, derived from or supplied by which nerves which is present to it, where from this particular part of the cartilage derived from. This is a numerical thing which you have to keep in mind related to this particular like arches 1, 2, 3 and 4 and 6, and then you have to know these particular cartilages, muscles and the nerve supply likewise. So, this is about this particular arches which is deriving from here is second arch, the mesenchymal element arriving from it. Third pharyngeal arch, relatively easy to memorize. Again, it has got very simple thing to memorize, cartilage, muscle and the nerve supply. There is one muscle which is derived from here, thankfully we have one muscle sourcing from here, we call them a Stylopharyngeus, which is related to the pharynx and anchored to the styloid process. So, this particular muscle is derived from third pharyngeal arch, and this muscle is supplied by the cranial nerve for this particular arch, which is ninth cranial nerve, we call them as Glossopharyngeal. So, this is one muscle and one nerve supply dedicated for it. So, the Stylopharyngeus muscle is supplied by the Glossopharyngeal nerve, and the cartilage or bones which is coming from it, we go for this hyoid bone, upper half is coming from second arch, lower half of the hyoid bone along with the horn, we call them as greater cornu, derived from this cartilage which is coming from the third pharyngeal arch. So, third pharyngeal arch and the second pharyngeal arch is contributing upper and lower half of this bone, we call them as hyoid. Where the hyoid bone is there? Above this particular voice box or this larynx which have got cartilage, on top of that we have the hyoid bone, and then we have this mandible. So, between mandible and this particular cartilage of this larynx, we have this hyoid bone placed. So, this is the easy one to remember and memorize. Fourth and the sixth. The fourth and the sixth as well has to have like an exchange of things, overlap of the things. So, you have to know the same sequel of the things, cartilage, muscles and the nerves. Cartilage is easy to remember. So all the cartilages that is present in the larynx or voice box, they are sourced from this arches 4th and 6th together. Don't have to memorize whether 4th or 6th. So 4th and 6th pharyngeal arch cartilages, they give rise to all of the cartilages in the larynx, like thyroid cartilage, cricoid cartilage, arytenoid, all of the corniculate, all of them are sourced from it. Together, you can just memorize cartilage of the larynx, which is coming from 4th and 6th combined together. Coming to these particular muscles. So muscles of the pharynx, there are two groups of muscles of the pharynx. One group of the pharynx muscle, we call them as circular muscle, also known as constrictor muscle. So muscles of the pharynx, which is known as constrictor muscle of the pharynx, they are sourced from it, and all the muscles that is present in the larynx, they are sourced from it. So if you cannot mix up between them, like which name of this muscle is sourcing from here, just remember these muscles of the pharynx and larynx, they are sourced from these 4th and 6th arches, to make it simple if you cannot memorize the intricate detail of it. But problem is that they dig deep into it, the MCQs, so they penetrate more. So for that reason, you have to know precisely where from these particular individual muscles and which arch is contributing. Like 6th arch contributing the muscles of the intrinsic muscles of the larynx. 4th arch is dedicated more towards the muscles of the pharynx, except one which is known as cricothyroid, which is coming from the 4th arch, which is coming off this cricothyroid, which is a muscle of this particular larynx, but sourced from 4th arches, which is important to it. Now all the muscles which is present in here supplied by the branches of vagus. Vagus have got two branches, one is superior laryngeal and recurrent laryngeal. So these branches of this particular recurrent and superior laryngeal nerve, which is a branch of 10th cranial nerve, vagus, they are supplying all the muscles of the pharynx, all the muscles of the larynx sequentially out here. So they are together supplying all the contributing factors related to the muscles, related to the muscles of the pharynx and larynx individual, and cartilages. So this summary of the charts that you have to remember, this is all your MCQs. They are going to test this particular chart through MCQs. They do not ask for a narration, or they can ask of describe the first arch derivatives. That means first arch, pharyngeal arch, you have to talk about nerve, muscles and the skeletal structures. They can ask about second pharyngeal arch, fourth, third, etc. individually. That narration could be there, which is if you are lucky enough. But if you are not that gifted one, then you have these particular deep digging things that, like, they pick a bone, they ask about where from they are sourced. They pick about this particular belly of digastric, they ask about the nerve supply to it. So likewise, this is what you have to memorize, no shortcut for it. You have to paste it somewhere in a place where you're going to see every day coming back, you can just like have a glance on it and remember these things. So this is about the pharyngeal arches. Now error which commonly not been tested in examination, usually deriving of first pharyngeal arch derivative. But problem is that if you have an error that most commonly affects that first pharyngeal arch, that means if you have a faulty development of the first pharyngeal arch, we have a clinical problem that commonly affects. So that common problem that is deriving a faulty problem of the first pharyngeal arch, we have two of them or three of them, like Teacher-Collins syndrome and Pierre-Robin syndrome. But you do not have to know the syndromic names over here. The concept is that whatever the things that is not deriving of it, that you have to know. The key thing of the first pharyngeal arch you got to remember here is that we develop the mandible from it. So if you have an individual where the mandible is ill-formed, the particular person is suffering from the problem with the development of the first pharyngeal arch. That's the thing that you have to keep in mind. So if you have a patient with absence or partially formed this particular mandible, or may have this particular complete absence of the mandible, agnathia, we call them as first pharyngeal arch derivative. Second problem, what could be there? You see, remember that two of the ear bones that is deriving from the first pharyngeal arches and one is from the second pharyngeal arch. So if we have a overlapping syndrome of the first pharyngeal arch, second pharyngeal arch, defect in cartilage formation, we have a conductive deafness experienced by the patient, because the ear ossicles are responsible for transmissions of the sound. So if the sound is not transmitted to the middle ear, to this particular inner ear, we are not hearing anything. So we have a deafness, and that kind of deafness we call them as conductive deafness, that is lack of transmissions of the voice. So this thing, you have that conductive loss of business. Any form of this particular problem of the mandible is related to this, with this kind of problem. Teacher Collins and Pierre Robbins. In pathology, hopefully they will teach more about this particular process of complications out there. For us, we just stop at this particular chart, which is important for it, for MCQs. The detail of this particular developmental source set or source from it, they can be asked in the MCQs and the narration. So in the supply exam last time, we had this particular thing, first pharyngeal arch derivative came as a question and MCQ as well. So it can come either way in MCQ or in a narrative questions. Coming to the other forms of contributory factor of the pharyngeal apparatus. So this is the second entity, we call them as pharyngeal pouches. Now we have covered this particular brown element so far. This brown element we call them as arches. Now we are going to deep to inside of it, endodermal side. That means inside the mouth cavity, where these particular elevations are there, in between them we have a depression, and between this depression we call them as pouches, and we call these pouches as pharyngeal pouches. They are present between the arches, and if you count the number, we have 4 such, right side, left side, or 4 pairs of them, and we number them craniocaudally likewise, 1, 2, 3, 4 like one. First pharyngeal pouch, second pharyngeal pouch, third and fourth. What do we have to do? We have to know for whatever the pouch is yielding, like the way we have done in the first pharyngeal arches. So we take one that makes these things clear for us. First pharyngeal pouch, that means that particular pouch is present between the endodermal side, between the arch 1 and arch 2. So this is the one which you are talking here. So this area of the thing that you are seeing here, we call them as in yellow, we mark here, is the first pharyngeal pouch. If you see this extended, this particular pouch, the distal part of it, it's expanded, and this part looks like a tube. So this particular first pharyngeal pouch yields to structure. This distended distal part creates the middle ear cavity, and this particular tube makes this tube connecting with this middle ear to the mouth cavity or this pharyngeal cavity. We call them as auditory tube or Eustachian tube. So first pharyngeal pouch yields to structure, middle ear cavity from the distended extended part like this, and a tube connecting to the middle ear, we call them as auditory tube, also known as Eustachian tube. So exam MCQs like auditory tube or Eustachian tube, source from which embryological structure, or the middle ear cavity, source from which embryological structure. So this is what you have to know about the first pharyngeal pouches. Then second pharyngeal pouch, which is this one, you are seeing that number 2. So second pharyngeal pouch, it's shallow, present between the second arch and the third arch, which is present in here, that creates a bed for the tonsil. So this particular pouch creates a space for the tonsil formation. So it creates the space, it do not create the tonsil. So it creates the space, curates it, so that the lymphatic tissue in this region can come and sit here and create the tonsil. In the tonsil over here, we call this as palatine tonsil. So this second pharyngeal arch present in here creates this particular palatine tonsil, and that particular tonsil which is present in here, present in it. But remember the difference between the tonsil, which is a lymphoid aggregate, and tonsillar bed or tonsillar fossa. So tonsillar fossa is the space. That space is created by this pouch. Within this pouch, tonsil develops. So this is what you call them as second pharyngeal arch. Third and the fourth is the most important and most clinically been tested. Now this third and the fourth is number 3 and number 4 like this. It's present between the third and the fourth arch, and the fourth and the sixth arch. So this is what we are seeing here. This third pharyngeal arch, this is number 3 and this is number 4. Now this particular third have got 2 subdivisions. One is yellow and red, just like the flag is Bengal Club, right? So this particular tissue which is present in here, we call them as third pharyngeal pouches derivatives. It has a part we call them as ventral part, it has a part we call them as dorsal part. So this particular yellow one, which is developing from this particular third pharyngeal pouch, develops into a gland, we call them as parathyroid gland. and this red one, which is elongated one, develops another tissue, we call them as thymus. So this third one yielding two structure, parathyroid gland and thymus. Fourth one, as you are seeing here, this one, yellow and blue, it yields into another structure. Again, it has a two part, ventral part and dorsal part. Don't go into ventral and dorsal part right away, because you cannot remember all these details. Part of it, which is yellow over here, developing again another thing, which is developing another group of parathyroid gland. And the blue one is developing, we call them as Ultimobranchial body. Now, we stretch it, what you learn. We have parathyroid gland in our body. We have two pairs of the parathyroid gland, or two groups of them. We call them as superior and inferior parathyroid glands. So if you count the numbers, 1, 2, 3, 4 are there. One pair superior parathyroid gland, one pair inferior parathyroid glands. They are present all together. So one pair of parathyroid gland is coming from the third pharyngeal pouch. One pair of parathyroid gland is coming from fourth pharyngeal pouch. Which one is coming in? We are going to break in. Now, this red one, which is the single one, it's going to form a gland, we call them as thymus. Where the thymus is present, which is present in the adult content, is within this superior part of mediastinum, where in the anterior mediastinum, this thymus gland is there. What kind of tissue is? This is a endocrine. This is a kind of tissue which has an endocrine capacity, but principally it is a kind of defense organ, which is going to yield some lymphocytes or lymphoreticular system work. So this thymus, which is coming here, going to settle down in the neck, in the thorax region. Which region we are developing in here is the neck region. So these organs, especially the thymus, has to travel a lot from the neck region to land up in the thorax region. We call them as migration. And then we have this blue one, which is the interesting one. We call them as Ultimobranchial body. Now, if you go to this particular thyroid gland, we have a thyroid gland giving rise to two kinds of hormone. Thyroid hormone, and along with that we have another hormone coming from it, we call them as calcitonin. Now, in a thyroid gland there are two types of cells are there, we call them as follicular cells, and by the side of the thyroid gland we have a parafollicular cells. The parafollicular cells, if you go through this physiology, they say that this parafollicular have got cells, we call them as C cells. The parafollicular C cells produce a hormone which is known as calcitonin. So that particular parafollicular C cells, that C cells which is producing the calcitonin is sourced from this blue structure. That means a half of fourth pharyngeal pouch. So coming together, third pharyngeal pouch, which is most commonly been tested amongst this particular pouches. So it has a two part, which gives rise to the parathyroid gland, other one going to give rise to the thymus gland. Fourth pharyngeal pouch, half of it going to give rise to same parathyroid gland and going to form an ultimobranchial body, which is going to form a cell which is known as parafollicular C cells. Now, which pouch is going to give rise which parathyroid gland now is the question. For that we have to know the migration pattern. Now, we have this particular third pouch developing a pair of the parathyroid gland and fourth pouch as well. The third pouch, which is deriving this parathyroid gland, migrates more or goes down and creates a group of parathyroid, we call them as inferior parathyroid gland. The parathyroid gland, which is derived from fourth pharyngeal pouch, do not move much, stays within that limit and creates the superior parathyroid gland. That means it's a paradox or crisscross. The third pharyngeal pouch travels more. So third pharyngeal pouch travels more, go down to this fourth pharyngeal pouch and go on the lower pole of the thyroid gland, settle down, we call them as inferior parathyroid gland. Other half, we call them as thymus, even aggressive, travels more, explores more, travels down all the down to the neck and settle down to the thorax in the superior portion. So this is what we call them as migration of thymus and inferior parathyroid gland. If we have a migration error, the parathyroid gland and thymus can land up in anywhere and can create ectopic thymus parathyroid gland. That's what we are concerned with when, if you are exploring thyroid surgeries. If you are going and doing for any surgery in the thyroid gland related to the thyroid gland surgery, parathyroid gland surgery, any neck trauma, you have to be mindful about this particular ectopic positions of the parathyroid gland and the thymus. namely we have a problem. So this is what you have to keep in mind related to this particular gland development of these particular pouches, ectopic thymus and a parathyroid tissue ectopic positions. So which is what developing in the parathyroid gland, that is what is important for us. For MCQ, this chart you have to remember. So what yields from pouch number 1, what yields from pouch number 2, 3rd and 4th. Out here 3rd and 4th, the important parathyroid gland, thymus, ultimobranchial bodies, parafollicular cyst cells. These are things that you have to know. So 3rd pharyngeal pouch yields inferior, 4th one superior, because 3rd one goes down, way down, goes down to this 4th pouch and settle down in the lower position, creates this thyroid gland, we name it inferior, other one superior parathyroid. They are both derived from the branchial division of this 3rd and 4th pharyngeal pouch. Thymus is coming from this particular 3rd one, settle down to the thorax. Ultimobranchial body, again very high MCQs. Hardly people get this particular developmental question right, which is creating a glandular tissue supporting cells. We call them as parafollicular C cells. Parafollicular C cells creates a hormone which is known as calcitonin. In deficiency of that, we have a disease, we call them as tetany. So this is what we have to know related to this particular pharyngeal pouches. So this summary and all our MCQ derivatives commonly hits this examination. Coming to the last and fag end of it, pharyngeal apparatus, last thing about pharyngeal cleft. So we have talked about the inner side, now we are going around to the outer side, that means ectodermal side. This is easy, but again this is exam high yield for clinical questions. So again between this particular arches on the external side, we have a groove, we call them as cleft. So you should have a clear idea what do you mean by the pharyngeal cleft and what do you mean the pharyngeal pouches, what do you mean by the pharyngeal arches. Now pharyngeal cleft, which is the ectodermal deficiency between these arches which is present and numbered there 1, 2, 3, 4 likewise, and it is easier to remember. Now go back to the pharyngeal cleft number 1, which is the one that you have to remember. This is number 1 and this is pharyngeal pouch, which is called or the other inner side. So this number 1 which you are seeing here is a blue one which is encroaching to this green to this particular yellow one, that means going to this particular pouch side. So this side we have seen this is going to develop the middle ear cavity and Eustachian tube. What happens to this particular ingrowing of this first pharyngeal cleft? They go down and try to meet with this particular other side of it and creates a tunnel which creates these external auditory meatus. That means the ear tunnel from the external side is formed here and reaching to this middle ear cavity. In between them, this particular membrane is the tympanic membrane which is formed between the middle ear and the external ear. So this pharyngeal cleft number 1 deriving of here is forming this, we call them as this external acoustic meatus or external auditory meatus. So this is what you have to keep in mind, what happens to this one, number 1. Now rest of the things, cleft number 2, 3 and 4. So this particular thing which is coming here, what happens here, 3rd and the 2nd, they overgrow, they grow a bigger structure, they join with each other and try to meet with the 4th one. And the 4th one, this particular 4th ridge as you are seeing here, which is pharyngeal cleft number 4, which is going up and meets with this fused 2nd and 3rd pharyngeal cleft, and eventually they close up. So this particular cleft number 3rd, cleft number 2nd and cleft number 4 eventually fuse with each other, leaving here only a fusion cleft or fusion gap, we call them as cervical sinus, and that particular cervical sinus should have completely vanished. So what happens to the cleft number 2nd, 3rd and 4th? They join together, form a tiny body, we call them as sinus, which is present in the neck region, we call them as cervical sinus. What happens to the sinus? Normally it should have vanished completely, no trace of it. Now if it fails to disappear, we have the problem. That's a clinical question. Now look at this particular individual lady. We have a lateral swelling in the neck region. Where the neck region swelling is there? In front of the sternocleidomastoid in SCM. So, this SCM is coming from the clavicle and the manubrium of the sternum to this mastoid process. This is the SCM prominent. Medial to that, we have a prominence over here. We call them as lateral swelling of the neck because it's present on the lateral side. Now, this swelling, as you are seeing here, can be present to any length between this attachment point of the SCM, can be between this mastoid to this particular clavicle. Here you see that the swelling is coming in this under the mandible, below the mandible region. This swelling, as you are seeing here, is because of the persistent of this one. What persistent of this? Cervical sinus. The cervical sinus or cervical cyst is failing to disappear, slowly growing under the skin and creating a mass. That particular mass we call them as cyst. What cyst? We call them as cervical cyst, also known as branchial cyst or pharyngeal cyst. Now, what's the location of the cyst? That's the thing that we have to look for. The location is in front of this muscle. Which muscle? SCM. The location we call them as lateral neck position swelling. And where this lateral neck swelling is present, any length between anywhere between this attachment of the mastoid process to the clavicle. So, this is how the clinically the individual presents to a clinic gradually coming swelling in a 20 years old person present in the lateral side of the neck in front of the SCM or sternocleidomastoid. Slowly growing, painless, no pain, no inflammation, nothing, just visible swelling with no associated with pain. Now, this thing commonly develops with age. It is not congenitally developed or not just like a developed at birth. Slowly grows bigger and bigger because of the secretion within this particular sinus grows in and presents with a latent swelling. Now, it can have two fates. That means the patient is reluctant, not coming for a clinical treatment. The swelling gets so big, it can rupture or burst open. If it is burst open through the skin, that create a sinus, we call them as sinus. And if that particular sinus is opening on the inner side of the mouth, we also call them as sinus. Now, that particular sinus we go by the name. We call them as cervical cyst sinus or branchial cyst sinus. Also, we can call them as fistulas. So, if the fistula is breaking through the skin, we call them as external fistula. And if it is breaking inside, we call them as internal fistula. So, commonly what is given to our examination is this one, the cyst, which is commonly given at your level. If you come to the surgery, if they get a time to teach you with the cases, hopefully, then you can see these particular cases in your life as well. So, this particular thing which you have to substantiate where from this growth is coming and what yielding structure is producing this and what developmental error had produced or procured this. This is what you have to grow. So, cleft have two entities. One is going to form the external ear, then rest of them fuse to form a vanishing tissue. We call them as cervical sinus. If it fails to vanish, can create a cyst. That cyst burst open, we call them as fistula. External fistula, internal fistula, the moment they are opening into it, we can classify it. This particular cyst is classically present on the lateral side. That's why we call them as lateral cervical cyst. So, in the neck region, the location of the swelling matters. Precise location of the cyst matters. So, follow this particular question where they are heading. They may not be given in picture to it because you have to just like read through these particular written words. Reading the word sometimes may not clear the idea. So, the key what you have to find here is that the location of here is lateral to it and they give a clue related to the SCM like anterior border of the sternocleidomastoid, this cyst are there. So, this is what you have to remember related to this particular thing of cyst and the clefts and this particular fissures and the fistulas. So, this is all for the day. We assemble again next day to finish off the rest of this development of the tongue and the tongue of the and as well as this particular thyroid gland.